Mr. De Los Santos came in initially for an evaluation or a consultation from a colleague that referred him over to. He had a injection in his hip as he was a kid, and this resulted in nerve damage that resulted in loss of some of the function of his lower extremity on the right side. When he had this loss of function, he had contractures of multiple muscles and multiple joints. Unfortunately, that led to him having to be able to walk on his tippy toes like a ballerina for the majority of his life. He began to have a lot of pain and discomfort that was inhibiting his ability to even just do daily activities. So he wanted to seek treatment or treatment options that he would have available, and we were happy to offer those for him.
Era imposible para caminar, es que se me hacía imposible caminar con el zapato. Cuando compraba zapatos, pues hasta que se domaba mi pie, pues, que se doblaba, es que yo podía caminar bien.
It was impossible to walk, especially with the shoe. He had to like kind of mold it for him to be able to walk.
Sí, me dolía, no, que el dedo grande ese se me doblaba con el zapato ahí para arriba.
Yeah, the toe in the middle would like fold with the shoe upwards.
Yeah, his foot was so stuck. I mean, it could not move at all, and it was causing him a lot of pain. So really happy that we were able to help him out. So based off the deformity that he had, it was a very complex deformity that required multiple procedures. The first initial one, it required to release multiple tendons and capsules around the ankle joint to be able to try to get some motion through the back portion of his foot. That resulted in us applying something called an external fixator that allowed us to gradually be able to make these adjustments so that his soft tissue could respond and his vasculature could stretch as we did this. Because having a deformity this long in somebody's life, the musculature and the vasculature and even the nerves themselves are very tight and shortened. And so if you are not able to make these adjustments in vast quantities, you have to gradually make them so that the body can adjust over time. After that procedure was successfully completed, that external fixator was removed, and then we ultimately had to go in and place some hardware inside his leg, which was something called an intramedullary nail. That allowed us to fuse the back portion of his foot in the position that we desired. And then we also had to do some osteotomies, or in other words, bone work, to be able to further dorsiflex the front of his foot so that whenever he stands, he's able to stand with his foot flat on the ground moving forward.
From the beginning, it started out really good.
Tanto las enfermeras como el doctor pues fueron muy...
The nurses and the doctor, they were all really good. Está contento que hizo esto y está contento con lo que resultó.
Contento.
Yes, very happy.
Yeah, he's stated multiple times how happy he is with the position of his foot and his ability to be able to do things, which is really rewarding to hear from a patient that had this big of a hindrance on their life, and to be able to do things that they want to do now and to be able to enjoy that. That's the greatest success story that you could ask for.
¿Le recomendaría al Dr. Aldridge a otras personas?
Es muy buen doctor.
Yes, he's a very good doctor.
This gentleman is 4 months out of surgery, which for him to be able to do what he's doing now is, like I said earlier, it's a testament to his desire to get better, and he's only going to improve from where he's at now. He's already made leaps and bounds.